rotation, okay, you're gonna do a posterior glide, right? Same as in the shoulder. So, let's do this week. So we can, if she has 90 degrees of flexion, that's fine. Take her to 90 degrees of flexion, take her to her end range of internal rotation, and then you can do a posterior shear, just like you did at the shoulder, posterior shear, posterior glide, okay? Now, if you do this in this position and you glide posteriorly, what do you think is going to happen at the hip? Are you going to actually be doing much of a stretch? Just imagine how the femur sits into the acetabulum. You're going to probably creating more of a compression than a stretch. Okay, compressing the back of the head of the femur into the acetabulum. You may get a little bit of a stretch, okay, but not that much, okay? So what you might want to do instead is roll her into internal rotation from supine position. Put your hand here, right as high up on the femur as you can. Pick up the soft tissue slat into the joint, and then glide into 3s or 4s. Okay? So you can do that with the hip in extension, or you can come back up here, take her into end range internal rotation, put your hand here and create a glide posteriorly, and you're going to get the femur moving this way. It's more of a stretch of the posterior capsule. So take up the soft tissue slack, glide and range, and you're doing either a 3 or a 4. And you're going to be doing that more with your body weight. What happens is I'm not trying to do this. What I do is set myself up into a position, and I actually lock her femur, my body, and my arm into one unit. So it's moving like this, not like that. Okay, because if you are always using your arms, you're going to get very tired very quickly. So that's posterior glide.
Yeah, so the first one you did was no good.
I don't think that that's effective. I think it creates more, it would be logical to do that, but I think because you're in 90 degrees, you're really compressing because of the way the head of the femur goes like that, you're really compressing. You may get some part of the posterior capsule that's being stretched, but I don't think it's as effective as the other way.
So what was the difference? Where were you in flexion with the last glide?
I'm still at 90 degrees, but my glide is this way, not this way.
So you're doing an interior glide?
I'm doing, well, it's also posterior. I'm doing a posterior glide, which at 90 degrees is the same as an inferior glide. So, and you would basically, if you did a belt distraction with her at end range, inferior glide, it turns out it's the same thing, just that this you could modulate with a braid, whereas the belt you keep steady. That's the difference. So someone maybe might be a little bit too painful for a belt distraction, might do better with this and work your way into the belt distraction. Okay? So for external rotation, we need to do an anterior glide. What we're not going to do is pull up on the femur. Come on to your stomach. So if we're gonna do an anterior glide, she's gonna be in her maximum range of hip extension. Let me revise that. She's going to be, if she has neutral, that's fine. If she has less than neutral, then I would allow that hip, so I'm not gonna work to increase hip extension necessarily. So I would put a pillow under her belly to accommodate to whatever hip extension she is lacking. But you don't necessarily want to do this, 15 degrees beyond 0. Okay? So I am going to be right up on the posterior femur as high as you can, and take her to her end range of external rotation. Take up the soft tissue slack to joint end range. Grades 4, grades 3. So this essentially is the same as anterior glide to increase extension. The difference is that I'm at the end range of her external rotation. Okay? And come on to your back. Okay. And then the last thing we're going to do is the hip quadrant, which is very similar to the scour technique. To put a little bit more detailed, okay? With the scour special test, you just started at 90, and you went up to 120 and around, and you allowed rotation at the hip. With the quadrant technique, you keep the hip in neutral. There is no rotation. Okay. You also add a little bit of axial compression through the hip, so you're pressing down. Start out at 90 degrees. Okay. You go maintain the compression. Go to end range for 120 or whatever she has. Take it around, tell me if anything hurts, to maximum adduction. But I'm not allowing internal or external rotation. Okay, so the femur is staying the same amount of rotation, neutral, no rotation, and you come across. And you can see that the knee describes an arc. Okay? Now, for many people, when you get to the inside corner here, they may complain of groin pain. If that's not the comparable sign, then it doesn't matter, because a lot of people that have no hip problem get a little pinching in that upper medial superior corner. So it's only significant if that's the pain that they complain of, okay? If they come in complaining of pain back here, and quadrant gives them pain there, it's like that doesn't count, okay? You can note it, but it's not what you're gonna work on, because you can work there and it's not gonna help, okay? Now, if she does complain of pain, we go through the same pain on, pain off, okay? So let's say she says, oh, that's my pain, okay? So then you're gonna just go around that pain. So if her pain is here in this arc, you're gonna just keep going like that for 20 to 30 seconds, and then you let it go, let the legs straighten out, relax, take her back up. You could repeat it 2 times, 3 times, no more than that on the first visit. Okay?
Do you put the hip at 90 and then start the compression?
Yes, that's where the compression starts, right here. Hip is at 90 and in neutral. Compress, take it up to our end range of flexion, maintaining the compression, flexion, abduction, around, 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 and around. Okay? Now, the only caveat with this is if I'm here and I compress, and she says, ouch, what's my question? Where? Where's the ouch? Okay, and if the ouch is here, right over the SI joint, then you really can't do this technique appropriately because it should be done with compression. So if they get pain in the SI joint, they might have an SI problem as well, which has to be looked at. You can't really test the quadrant. So SI pain that's provoked with a compression is a contraindication to the quadrant technique. Okay? So they'll practice internal, external rotation